Hey there everybody, welcome back to the channel. We are currently in between appointments, so as promised we are doing a weekly Q&A. Today's topic comes from Barbara, who asked, what is heartworm disease and is there any alternative treatment to what my vet is trying to prescribe me? Now, great question, Barb. I feel like we talk about a lot of things in the appointment that we don't really get across too well. Point being heartworm disease, flea and tick prevention, Lyme disease, canine influenza. We don't really dive into what these things are. The only point we really get across is that they're not really great for your pet. Now, we can go into great detail about the pathogenesis and life cycle of heartworm disease, but for the point of this channel, we're just going to cover the basics. So, heartworm disease. Heartworm disease is basically spread from species to species by mosquitoes. Now, for all my folks out in Arizona who do not believe mosquitoes exist, trust me, they do. So basically what happens is when a mosquito bites an infected animal, these tiny little heartworms called microflaria start to develop inside of the mosquito. Within about 2 weeks, these microflaria are developed into infective larvae, which can then be spread to another animal once that mosquito has its blood meal. Fun fact, now while most cases of heartworm disease are seen in dogs, cats are very susceptible to it as well. So for all my people that say, my cat doesn't go outside, I truly hope that your house is airtight, because if you've never had a mosquito in your house, go buy a lottery ticket. Anyways, these infected larvae develop inside the animal in about 6 months. If undetected or untreated, these larvae will migrate through the animal's body, eventually reaching the blood vessels of the lungs, damaging these vessels, which will then eventually damage the heart. Now, when the heart is damaged and cannot pump blood, it's really not the ideal situation, right? That's basically what heartworm disease is. Now, why don't we test every single puppy that walks through the clinic? Because since most tests only pick up on the adult female worm, nothing would likely show up on the test prior to the 6-month term. So that's basically why we don't test prior to 6 months and we test annually. Now, on to your second question. Is there anything natural or alternative to treat heartworm disease or prevent heartworm disease other than what your vet is trying to prescribe you? Well, I'm sure there are things out there, but unless there are definitive studies done on a very large spectrum of species and animals and it has great results, I'm not going to fully endorse it. But seriously, why potentially risk your beloved pet's health when there are so many solutions out there? There's a monthly pill, there's an injection that you can do every 6 months, and now there's an injection you can do even every 12 months. Modern problems require modern solutions, and the FDA has a bunch of approved modern solutions. Not to mention, I'm not too sure about the chakra or shredded carrot policy, but most manufacturers will actually cover the cost of your animal's heartworm treatment, as long as you can prove that they were on the heartworm preventative during that term. And yes, it does happen. Nothing in life is going to be 100% absolute, but we can get pretty damn close on the heartworm prevention. Anyways, that'll cover heartworm disease for this week. Drop a comment or direct message us if you want your topic to be featured next week. Don't forget to like us on Facebook, follow us on Instagram, and on behalf of Dr. Joe's Veterinary Services, thanks for watching, and we'll see you out there.